Welcome to the Rotary Club of Nairobi, Muthaiga North, also known as the warmest club in town. Our spirit of joy, love and celebration is unrivaled, and it was evident at our installation party this past July. The theme, a masquerade party. Although some of us forgot our masks, the party went on joyfully. But when the party's over, we roll up our sleeves and we get to work. We grew our numbers for a start from 82 members in June 2021 to 116 6 months later. We are also proud to have a total of 29 PHFs in our club. Our focus areas are maternal health, water and sanitation, disease prevention, basic education and literacy, and environment. Here is a snapshot of our projects. On our Mother and Child project, we equipped 3 hospitals in Narok, Nyeri, and Kisii with equipment, additional equipment, and also provided training for health workers. The project was successfully completed, and the final report was filed and accepted by the Rotary International Grants Office. Having successfully completed 2 phases of this project, this is now a flagship project for our club. And we have embarked on the next phase, where we aim to equip maternal health units in various hospitals across the country, as well as doing capacity building and training for health workers. Efforts to identify beneficial hospitals are underway, and we have already identified and secured 1 international partner. We are looking to fund the project through a global grant. For Global Handwashing Day, we received a donation of over 6,000 bars of soap and carried out hand washing demonstrations in 3 schools. We donated soap, books, we conducted tree planting and had mentorship sessions with students from the beneficial schools. Over 3,000 students benefited from the campaign. In addition, we continue to donate sanitary kits, mentor students and plant trees. The Morning Star Children's Home is one such example where they have been a beneficiary of our food donations and tree planting activities. On disease prevention, to help the Ngewa Health Center easily and effectively access the services of the National Health Insurance Fund run by the government, the club donated a computer, a router, and 6 months of paid-up internet connection subscription. You can imagine that this gesture goes such a long way in improving delivery of healthcare services to the local community and enabling them to access these services. The Saikeri Community Empowerment Project, a project that started as a conflict resolution exercise. We have successfully resolved the conflict between 2 conflicting and neighboring communities, donated food rations, and now we're looking to engage in a more sustainable program for the community. How are we doing this? By drilling a borehole to promote access to clean water, setting up a trading center and a table banking program to empower them economically. In addition, we have secured an international partner for the project and are anticipating funding through a global grant. On basic education, water and sanitation, our Rotary Model Schools initiative addresses multiple areas, all with the aim of offering quality education by providing all the necessary amenities of a modern, self-sufficient learning facility. We are currently in talks with 2 international partners in Korea and Australia. Across all our projects, one thing to note is that the exercise doubles up as a needs assessment opportunity for some of our upcoming projects. Now, you can imagine that running projects like this takes funding. So through a well-thought-out strategy, we outlined a calendar of events whose goal is to help the club generate funds to cater for projects to be undertaken over the next 3 years. We achieved great success. The activities were fun, engaging, for maximum involvement and participation by members, guests and friends. Some key highlights were the bowling event that we dubbed the Hangout. Held in September last year, we made it a family event and had an absolute blast as we bonded in the true spirit of Rotary, succeeding in having lots of fun and raising some good money. In November, we then had our renowned golf tournament at the Windsor Golf Club, with great participation from external and internal sponsors, members and friends. To crown the event, we had a great dinner in the same venue and members came out in style. They stepped out in style. It was an evening of fun, of bonding, as well as trying to interest all our guests present in joining Rotary. This year, to kick off the year with a bang, we held a tremendously innovative hike that we dubbed Hike Your Age. What does that mean exactly, Hike Your Age? This fund required that members and friends donate an amount and multiply it by their age. There were lots of jokes as some of us tried to be 21 instead of 50, but in the end, with the four-way test, we all came out strong, not only to pay up and raise funds for these important projects that we have lined up, but to also have a fun-filled day of fitness and exercise. Our balance of term activities are Valentine's dinner, as we dance to the classics of the 70s and the 80s, and a hospital bed race slated for April 2023. For Rotaract, we march with our baby club, Rotaract Club of Nairobi, Muthaiga North, as we installed President Karori to office. We've also spent time strategizing with our two Rotaract club members on what their needs are and supporting them as we actively mentored them and integrated their members and themselves into mother club activities. We're going international because we are international. And this was evident as we saw off our very own DGSR Muthoni Geshohi, who was appointed ambassador to China. And we joyfully celebrated her during a warm send-off hosted by PDG Eric Kimani and his gracious wife, DGSR Margaret. Partnerships, as you know, are an important part of scaling and an important part of creating broader impact. And we now have partners in Korea and the US and continue to work on extended partnerships around the globe. As the warmest club in town, we are honored to serve and look forward to continuing our march together towards making a difference.